Hi, this is Dr. Jonathan Youssef, Networking for Your Optimal Health. Today's topic is going to be about hormone replacement therapy. Here at Lifetime Family and Urgent Care, we like to talk to our providers and patients about hormone replacement therapy. What are some of the things that my patients are complaining about? So typically men at the late age of late 40s to early 50s, they'll start complaining of symptoms of fatigue, low energy, low libido, sleeping after dinner. And these symptoms can be a sign that you have low testosterone, or maybe your hormones are just not balanced correctly. So in regards to my patients with those symptoms, especially in men, we draw their blood and look at their testosterone level. We look at a free and a total testosterone, but we also look at other hormones, estrogens, progesterone, and cortisol. In addition to these, we also look at their complete blood count to make sure they don't have thick blood, or their PSA, which can be a concern in regards to using hormone replacement therapy for men. What are the treatments for men for hormone replacement therapy? Well, there's three things available right now that we use in our office. Number one, we use the testosterone injectables, Cyprinate or Enanthate. This is weekly or every 2 weeks injection that can help raise your testosterone levels. It's said that by the age of 20, every year thereafter, you would lose 1% of your testosterone. So sometimes at the late age of late 40s, early 50s, it is natural for most people or most men to lose some of their hormones. In addition to the injectable, the second or number two is the topical creams and gels. These can be also used, and these gels and creams can be done on a daily basis, which can replace your hormones. Some people like those and are very functional and easy. You don't have to get an injection. But the negative aspects you have to be concerned about is that it may be contaminating other people in your household. So you have to be very careful with that, and it can be a little bit messy. Number three, testosterone pellets. So normally there is a medication called Testapel, which can be implanted. I typically put 10 to 12 pellets into the right or left hip. And this is a minor surgical procedure, minor in-office procedure that takes no less than less than 10 minutes. And this pellet insertion can be used instead of doing the injections every 2 weeks, which can be very painful and time-consuming. And these pellets can last anywhere between 3 to 6 months. So there's also compounded versions of a lot of these products, compounded injectables, pellets, and as well as creams and gels. So let's talk about female hormone replacement therapy. So traditionally around your late 40s and early 50s for females, they're also getting the premenopausal, menopause, or postmenopausal symptoms. Those can be hot flashes, mood swings, and night sweats. Traditionally, the medication or the supplement or the hormone that we use is estrogen. And there are combinations of estrogen. Estradiol is the most popular one, although you can use estriol or estriase. And these can be combined in hormone creams or tablets as well. So for women, I check their hormones as well. FSH and LH, these are follicular stimulating hormone or luteinizing hormone. You can do that in your blood. You can look at estrogen levels as well as testosterone and progesterone levels. So the majority of my female patients, I start them early with progesterone. I like to use a progesterone cream. There are some over-the-counter supplements, but there's also prescription progesterone, and these can be in pill form and as well as a high-potency compounded cream. Normally, if you're a female who has a uterus, you want to take estrogen and progesterone together because unopposed estrogen will cause the uterus lining to thicken. So you do need progesterone if you do have hormone replacement therapy. For those who don't have a uterus, they can just opt for estrogen alone. So that's why I like progesterone early on. I believe heavily that the use of it can slow down the process of losing or depleting your hormones. And with the use of estrogen in combination, it can take care of a lot of the symptoms that females complain about: hot flashes, mood swings, and night sweats in particular. And for progesterone, trouble sleeping, migraine headaches, hair and skin changes. So those are my basic discussions regarding hormone replacement therapy. There are other hormones such as DHEA and cortisol that we can discuss further, and there's a lot more to discuss when you come see us at Lifetime Family and Urgent Care. Thank you.